Hello everyone, this is Dr. Sukhmeet Bedi. Welcome to Anatomy and Physiology. Today I'll be explaining the topic cardiac output. Cardiac output is the amount of blood ejected by each ventricle in 1 minute. To compute the cardiac output, we need to know the two factors, that is your heart rate and the stroke volume. Heart rate is actually the conducting system of the heart and is the number of times the heart beats in 1 minute. And stroke volume is the amount of blood ejected by each ventricle every beat. So to calculate the cardiac output, we multiply the heart rate with the stroke volume. For example, in a normal resting individual, the heart rate is about 75 beats per minute and the stroke volume is 70 milliliters per beat. So we cancel out the beats and we are left with 5,250 milliliters per minute. Approximately 5 liters of blood is pumped by each ventricle in 1 minute. Now there are 4 determinants of the cardiac output. The first one is the heart rate. Heart rate is actually the conducting system of the heart, that is the number of times the heart beats in 1 minute. There are certain factors which alter the heart rate. These are called the chronotropic factors. The factors which increase the heart rate, they are the positive chronotropic factors. For example, our sympathetic nervous system, certain drugs like atropine. Then there are certain factors which reduce the heart rate. They are called the negative chronotropic factors. For example, the parasympathetic stimulation and certain drugs like adenosine. Then second is the preload or the end diastolic volume. It is the amount of the blood left in each ventricle at the end of the diastole or at the end of the filling. And it depends on the three factors, that is the venous return to the heart, the contractility, and that is the contractility or the atrial contraction, and the blood volume. If the venous return is increased, then the preload will be increased. Increased preload will increase the stroke volume and that will increase the cardiac output. Now the second factor which affects the cardiac output is the afterload. It is the end systolic volume, that is the amount of blood left in the ventricle at the end of systole or emptying. It is actually the back pressure exerted by the blood in the aorta and the pulmonary artery on the ventricles. Pressure exerted by aorta on the ventricles is about 80 mm mercury and the back pressure exerted by the pulmonary arteries is about 8 mm mercury. The factors which increase this afterload are like atherosclerosis. The next factor is the contractility. That is how hard your myocardium contracts. The factors which increase the contractility are the positive inotropic factors like calcium ions, hormones, glucagon, thyroxine hormone, and certain drugs like digitalis. And the factors which reduce the contractility are the negative inotropic factors like the excess of hydrogen ions or acidosis, the calcium channel blockers, and rise in extracellular potassium ions. So what are the 4 determinants of the cardiac output? The afterload, the preload, the contractility, and the heart rate. I hope this topic is clear to all of you. If you have any queries, you can leave a comment in the comment box. Thanks for watching. Have a great day ahead.